Twitter explodes with ECMO requests. Demand for life-saving machines increases. Not a magic bullet, warn doctors. What is ECMO and when should it be used? Our top focus on India today. Hello and welcome to this very informative broadcast where many of your questions on critical COVID care will get answered. I'm Chaiti Narula. In the past few days, there's been a huge explosion of requests for ECMO machines for critical COVID care patients. Doctors say that this life-saving machine, ECMO, is beneficial in some patients and in no way a magic bullet. I'm reiterating, in no way this is a magic bullet. The other problem is that there is a serious dearth of these machines in India and qualified professionals to operate them in India. And hence, the anxiety and frustration follow for a patient's skin who are running pillar to post to find one for a patient who's deteriorating on ventilator support. But first, let's begin with this report. Twitter explodes with ECMO requests as critical COVID cases go up. ECMO is in demand in India. But what is it exactly and what does it do? Doctors warn, use it only as the last resort.
The benefit of ECMO is there only when a proper patient selection is there, planning is there, execution is proper, and the weaning from ECMO is also done judiciously.
ECMO, or the extracorporeal membrane oxygenation procedure, is expensive but used as the last resort when everything else has failed. It is a method where blood of the patient is drawn out of the body into a machine. The oxygen is mixed with the blood using a special procedure, and this blood is pumped back into the machine and sent back to the body, giving rest to the heart and the lungs of the patient. Once the patient is on this machine, it is touted unethical to remove the patient off it unless the doctor feels the patient has stabilized.
ECMO is used during life-threatening conditions such as severe lung damage from infection or a shock from a massive heart attack. People who use ECMO are very sick, and it is by no way, shape or form is it a magic wand. There's no guarantee that if you go on ECMO, you're going to have a good outcome.
Not all hospitals have this procedure, and not all know how to operate this complex system. To top it, it can cost the patient's family anything between 1 lakh to 3 lakh rupees a day to be on this. This works as an artificial heart-lung machine that may help the damaged lungs to heal. Many people are made to believe that ECMO is some magic wand. The fact of the matter is, doctors warn it is not any magical machine, but yes, it does help the lungs recover with a mortality rate of not higher than 50% once the patient is on this treatment. It keeps the patient stable till the lungs recover or they have a lung transplant. And hence, consult experts, take multiple medical opinions before stressing over ECMO, which is in serious dearth in India. In New Delhi, Chaiti Narula for India Today. I'm being joined by a prolific panel today, Dr. Sandeep Nathan, who is an authority on this subject. He's a co-director of Cath Lab, University of Chicago Met. I'm so thankful for you to take your time out and join us on this broadcast. Welcome to the show, Dr. Nathan. And
hope you can see my video feed.
Yes, we can see you. Don't worry about it. Dr. Sameer Gupta, Director of Cardiology, Metro Hospitals, is also joining us. And Tehseen Poonawala, he's a COVID warrior. Poonawala Foundation, he's been mobilizing help, resources, attending to all those multiple SOS calls of requests on Twitter. Tehseen, to you first. I want to understand from you this goose chase that is going on for ECMO machines. It's been supremely manic on Twitter for you. I've been seeing that. I've seen you step in and mobilize these machines and get them timely help. But many times you've tried your best through your foundation and have had to apologize. What's happening in India with the ECMO demand, Tehseen?
Chaiti, as you rightly introduced in your show, that ECMO is not a magic machine. Unfortunately, a lot of our fellow citizens who are sick believe that by somehow getting onto ECMO, they're going to get cured, and therefore there's this rush for ECMO. The government also did not plan for the second wave, did not see what were the effects on the lung in the US and Europe, and asked for more machines to come into India. Also, it's not just the machines, it requires specialists who operate this machine. So there is a demand and supply issue. The most difficult part about this is to tell, when you search for a machine, if the machine is even available, it is the consulting doctors at that point and the experts who will take a call whether the patient can be put on that machine or cannot be put. See, ECMO cannot cure you. It will keep you stable till your lungs recover.
Tessie, I want to understand the goose chase that is going on. How many people have reached out to you and how manic has it been for you on Twitter and on social media where you're helping people out?
Hundreds of people per day. And you know about this, Dr. Sameer knows about this, because we keep putting this up in various groups, hundreds of people per day. And there aren't so many machines. Delhi doesn't have so many machines. Just from Delhi, the requests are more than 100 every day. And you cannot get a patient off an ECMO machine till the patient stabilizes or unfortunately passes away or has a lung transplant. So there is a dearth of machines. What is worse is to tell the patient that the machine isn't available, and they go about everywhere trying to find a machine. And most of the time, the patients, say from Delhi, cannot be shifted to Chandigarh if a machine is available, or Hyderabad airlifted, and then they start feeling guilty. Also, there have been cases where we've got an ECMO machine organized, the hospitals come in to take the patient, and the patient, just when he was removed of the ventilator, the oxygen levels completely dropped. Within a couple of seconds, they had to be put back, and therefore could not be put on the machine. So families are going through a lot of guilt. Families call up and tell us desperately they're ready to
And I'm
sell
aware
our
of this specific case that you're talking about too, Tessie. I'm going to come back on this particular case because that was a very difficult time for you, I know personally. Dr. Nathan, is ECMO by any means a magic bullet? What would you like to tell those who are crying out for help today to lay their hands on an ECMO machine in India? Is it a lifesaver?
You know, Chaiti, I think it's a great question. I understand the desperation with what's going on in India and the world over. ECMO is not a magic bullet. It's a very important tool, but it's a tool that's only useful in a very selected population of patients with COVID-19. At our institution, the unifying characteristics of people who actually do well on ECMO with COVID-19 is that really the only organ system that's knocked out is the respiratory system, so that they have pulmonary failure, respiratory distress syndrome, and so forth. They don't have multi-organ failure. They have to be younger. They have to be free of other medical comorbidities, and they have to be close to their ideal body weight. Absent that, it's a very difficult, very difficult path, even with ECMO support.
What is the mortality rate, Dr. Nathan? You're somebody who is an authority on this subject. What would you say the mortality rate on ECMO is? Because many people over here in India feel that, okay, the patient's oxygen levels are dropping on ventilator, is deteriorating on ventilator. Then the doctor advises move this patient to ECMO. There's a mad rush for wanting ECMO machine. But after many consultations, the patients can really realize that the mortality rate on ECMO is not great. It's not something which magically is going to revive the patient.
Right. You know, I think that's a great point. Early in the pandemic, there were reports of 90% mortality on ECMO, and there was a call for futility. There was a call to abandon this goal of putting patients on ECMO. I'm happy to say that in more recent data, the mortality rate has improved, but I think it's partly a recognition that not everybody can benefit from ECMO. So there's a lot of selection bias that goes into this data. To be fair about this, the international data would suggest that the mortality rate has dropped quite a bit, but with a heavy degree of selection. And as the previous guest had mentioned, this is a bridge to recovery, or it's a bridge to lung transplant. It does not magically fix, unfortunately, the ravages of COVID-19 pneumonia.
And you know, you mentioned that there's only 90% mortality as reported earlier. Of course, the mortality is improved now. 90% mortality, for the benefit of our viewers, means 10% of the patients probably would not make it when they go on, 90% of the patients rather would not perhaps make it when they go on the ECMO machine, and 10% only would perhaps make it once they are on the ECMO machine. And now the mortality, according to Dr. Nathan, has improved. Dr. Sameer Gupta, somebody who is on the ball when it comes to this particular treatment here in India, would you call ECMO the last resort in a critically ill COVID patient? And how would you, Dr. Gupta, counsel the patient's families on the pros and cons of this device? Is it an artificial support of the highest nature? Is it only used when ventilators cannot support a failing lung? How would you advise patients' families on the pros and cons? And through our medium, why don't you advise them?
Thank you so much, Yati. I think this is a very important question, which has become more important of late, given the number of requests that are coming in. We are getting requests of people who are on simple oxygen, on nasal oxygen. They're like, I want my father on ECMO, I want my sister on ECMO. So it's important to understand when ECMO is important and who are the right people for it. Now, first, it's important to understand what is ECMO, right? ECMO, like you said, it stands for extracorporeal membrane oxygenation. So what it basically does, what we do in this procedure is you put two catheters, cannulas, which are like tubes. These tubes go in your neck and in your groin. And from one tube, you take the blood out. Okay, you take the blood out, you put it in a pump and you mix it with oxygen and you take the carbon dioxide out. So it's basically doing what the lungs do, right? They give oxygen into the blood, they take carbon dioxide out, and through the other tube, it goes back into the body. So that's basically what ECMO does, right? It's doing the work of the lungs. So if your lungs are failing, if you're on a ventilator, if you're not able to maintain oxygen on a ventilator, there are some very specific parameters we see. We see the PaO2 over FiO2 ratio. There are all these different parameters we see in which we determine if the person is meeting criteria for ECMO. If you are meeting criteria for ECMO, then you only then should you go on ECMO, because the question is, we put somebody who may not need ECMO, you put them on ECMO, and now ECMO has its own set of complications, right? I mean, when you're putting these fat tubes in your body, catheters, these thick catheters, they can have their own set of complications. You can have bleeding, you can have infection, you can have hemolysis, which is basically breakdown of your blood cells. You can have brain problems, neurological issues. There are the whole set of problems that you can have if you do go on ECMO. So ECMO is used only for very specific circumstances. It is not the Ramban, the word that is being used right now. And those people who are on ECMO are probably the sickest people in the hospital.
Tehseen, how frustrating has it been personally for you? I know there are patients who you were trying to line up for the machine for, and you put them on wait list in several different hospitals, but before their turn came, they did not even make it. And there were certain cases, like you just mentioned earlier also, the ECMO was available in another hospital, the patient had to be moved, the team came here, the minute the patient was taken off the ventilator, the oxygen saturation levels dropped, and hence you could not even put that patient on the ECMO support. And most of these patients who you've helped out have not made it.
Absolutely, and therefore I completely agree and concur with Dr. Sameer Gupta said, and I've been consulting him and his brilliant team a lot on cases. The first part is you need to have the absolute latest reports, and the doctor or the team that will put the patient on ECMO needs to analyze the patient at that particular point of time. A lot of times the parents or the family members have previous records and they believe that would help. The second part is, once you find an ECMO machine and a team comes, like the case that you're talking about, if the patient simply cannot make it for whatever reasons, as Dr. Nathan said, whether he's overweight, is not the ideal body weight, he has comorbidities, you simply cannot put the patient on an ECMO, and the families then start feeling very frustrated. Dr. Sameer is right. I personally dealt with a case where a girl who got an oxygen bed and her father was on about a healthy oxygen level of, not healthy, but about 87, 88, wanted her father to be shifted on ECMO, and we had to explain to her that ECMO, you don't go from an oxygen bed to an ECMO. So I think that somewhere down the line, I'm grateful that you're carrying out this program, and I hope our citizens realize that ECMO is not a magic pill. It is for the sickest of our patients, and we need to be very specialized in this treatment and understand who go on to this treatment.
Dr. Nathan, could timely ECMO make all the difference, or would you say if the patient does well on the ventilator, do not rush, get multiple opinions before moving the patient onto an ECMO machine?
Yeah, I think that if patients are doing well with standard ventilatory maneuvers, and there's a lot of them, it's not as simple as just putting a patient on a ventilator. There's a number of other maneuvers that can be performed to improve oxygenation. I think those patients should be left alone and let the process of healing occur. For the sickest of the sickest, as we mentioned before, ECMO may be a boon, but it has to happen early and it has to happen before multi-organ failure. The unfortunate reality of COVID-19 illness is that it affects almost every single organ system. Reports are pouring out every single day of the new manifestations of COVID-19. ECMO as a standalone technology really fixes one problem, as my colleague Dr. Gupta mentioned. It does open the door to several other potential complications. The patients that are successful going on ECMO are the ones that only have a single problem and stay relatively free of some of the complications.
Dr. Sameer, how expensive is ECMO today in India? And barring a few hospital, why is it that we cannot find it in India, the machine and the staff both, to operate the machine?
You know, ECMO, Chetty, is a very sophisticated piece of equipment, and it requires a lot of medical expertise to use, and it requires a lot of fine-tuning on a day-to-day basis, if I was to say that. The machine cost can vary anywhere from, what I understand, from about 40 to 50, 60 lakhs is the cost of the machine, but that is a small component. And there are all these consumables that go in, all the ICU care, all the blood tests that need to be done, the manpower required. So it's a very sophisticated piece of equipment, and you know, it has suddenly got a lot of fanfare in the last few weeks. Given COVID-19. This technology has been around for a while. If we go back and see the medical literature and medical history, it has been there from the 1970s, 80s. Initially, when ECMO came out, it was used a lot in children, and the reports in adults were not very encouraging. But it wasn't very recently, and I would say recently.
No, but for critical COVID patients, I would say about 1 lakh or 3 lakh rupees per day. Is that a right estimate, Dr. Sameer?
Yeah, I think that sounds about right. And this number can vary from place to place, institution to institution. But yes, it is a fairly expensive treatment, and it requires a very good medical support team and doctors who know how to use it.
And hence that begs the question, Dr. Nathan, how many days is a critical COVID patient kept on this ECMO support, and when does one take the patient off? Many viewers do not know this because it costs lakhs and lakhs a day. Most people would not even be able to afford it sometimes. Patient would need it sometimes for weeks together.
That's absolutely right. You know, both from the international registry, from ELSO, the ECMO Life Support Organization, as well as more recent U.S. data, the average time on ECMO spans weeks, well over a month before some sort of destination, whether it's demise or survival and liberation from ECMO or lung transplant. It is on the order of well over a month that patients are typically on ECMO at our institution. It's not uncommon for patients to be on ECMO for 20, 30, 40 days before they either get better or get transplanted.
And Tehseen, I know that a lot of patients and a lot of people that you're helping out, SOS, the requests are coming on Twitter and many other social media platforms. I'm just wondering what happens in the rural areas, and for people who do not have social media, who do not have access to Samaritans like you on social media. I'm just trying to understand how they end up getting basic support, leave alone ECMO.
We don't have enough support in Delhi itself, which is the national capital of India. Rural India is completely off the radar. But I want to just extend one point that Dr. Nathan said. I think it's very important for your viewers to understand that ECMO is not going to cure you in 2, 3, 4 days. A lot of patients we deal with, and this is the most difficult conversation I had, is to see if they have the financial resources to undertake that. Otherwise, the entire family is going to end up selling everything that they have for a case that may not be viable. So it can take 20 to 30 days. Unfortunately, a lot of people believe in social media believe that you'll be cured in 4 or 5 days on ECMO. And I think that is a misconception. I'm very grateful Dr. Nathan and Dr. Sameer put that out and through your show that people now know about this.
And Dr. Sameer, one winding comment from you. Is Tehseen right when he says that the treatment could go on for weeks and weeks and it will be very expensive, and the mortality rate as it stands right now, almost say 50 thereabout%?
Yeah, you know, so the goal is, so when you put people on ECMO, right, when you put somebody on ECMO, you're waiting for one of 3 things, like Dr. Nathan said. You're waiting for, it's a bridge. So it's a bridge to recovery. That means either the lungs recover. It's a bridge to decision. You're trying to figure out what to do next, how to go about it, so you're buying some time. Or it's a bridge to destination, that, you know what, these lungs are not going to recover, we're going to go for a lung transplant. So this is a bridge to transplant. So this is the way how we in the medical fraternities think about ECMO. And yes, you know, till either the person, you know, if he improves or if he dies, or if he gets a lung transplant. So this is kind of the way it is. And if somebody is on ECMO, I know that we've had these conversations before where somebody says, you know what, I have ECMO for 3 days, I have the machine for 4 days.
Yes.
that is usually a very tough call to make, because like Dr. Nathan said, these patients may require it for weeks.
Absolutely.
And it's kind of it becomes unethical to take the machine out when the person is surviving.
Absolutely, and that's one thing that everybody watching the show needs to understand. Dr. Nathan, your winding thoughts as far as ECMO is concerned, your advice going out to our viewers who are seeking ECMO support today and are running pillar to post for their families, for their whoever's critically ill in their family to make it happen. What is your advice going out on a winding note?
I think it's an invaluable technology, but for a very limited population of patients. And I think that everyone that's listening to this has to sort of understand that this is not for everyone. When you go on ECMO, it is a very long and hard-fought struggle ahead of you. And if there is the overlay of other medical complications or non-pulmonary COVID disease, then the outcomes are very questionable with ECMO. If you have single system disease, if you're young, if you're otherwise healthy prior to this, and your ideal body weight, and typically our cutoff at our institution is 50 years of age and a BMI, body mass index, of 30 or less, then the outcomes are more favorable, but it's anything but a sure thing.
All right, that's very valuable advice going out for all our viewers, and many of their families have their near and dear ones in the hospital today, battling it out with COVID. Some of them are critically ill. Many doctors have advised they go on ECMO treatment. But today, these doctors on your screens, Dr. Sameer Gupta, Dr. Sandeep Nathan, have cleared out the frequently asked questions as far as ECMO treatment is concerned. And Tehseen Poonawala, who's helping so many out there organize ICU beds and ventilator support and ECMO machines. Thank you very much for your contribution to society as well, Tehseen. And thank you so much, both you doctors, for taking the time out and addressing the question, the all-important question on whether ECMO is a magic bullet or not. And the answer is no. With that, thank you very much. That's it from me, Shweti Narula. Thanks for your time. Thanks for watching.